Welcome back. In this segment, we will discover the answers to the following questions. Why me? Why did I get diabetes? What are the risks and symptoms of diabetes, and how does diabetes affect my body? To help explain and understand why you got diabetes, we will first need to look at some of the risk factors. There are two types of risk factors, ones we can modify or change, and ones we cannot modify. Let's start with the ones we cannot change. The first factor is family history. When you fill out paperwork at the doctor's office, you're always asked to list your family history. These are your genetics. What we're looking for here is first-degree relatives with diabetes. So in this case, if you have family history of diabetes, you will be more likely to get diabetes. That does not mean that you're doomed and destined to have the condition. It simply means that you will need to pay attention and take preventive methods. However, with lifestyle interventions, diet modifications, and being physically active, you can postpone the onset of the disease or not contract diabetes at all. In essence, you might have the diabetic gene, but the gene might not present itself unless provided with a fitting environment. What does that mean to you? If you have diabetes in your family history, it is imperative that you take preventive measures now to avoid getting diabetes. If you are someone with family history of diabetes and you have already been diagnosed with prediabetes, the time to start lifestyle and dietary interventions is now. Prediabetics may already have sugar damage to their kidneys, eyes, blood vessels, and nerves even before diabetes is diagnosed. Evidence from numerous studies suggests that chronic complications of type 2 diabetes begin occurring during the prediabetic stage. This means that this is your responsibility to try and prevent diabetes and even prediabetes as early as possible. As mentioned before, many people walk around with prediabetes unknowingly. By the time they reach diagnosis, diabetes might be difficult to control. This is why it is recommended that you keep up with your regular checkups. It is important to note that due to different risk factors, diabetes might be treated differently for different people. Some people may benefit more from exercise, others may benefit more from dietary changes. Either way, lifestyle changes are necessary for improvement of the condition. Another risk factor is race or ethnicity. We have heard the popular saying that disease sees no race, but in the case of diabetes, it is a little bit different. In general, most non-white populations are at a higher risk for type 2 diabetes. This should also be seen as another red flag. Another risk factor we cannot change is age. So in this case, as in the case of many other chronic conditions, the older we get, the higher the risk for type 2 diabetes. Imagine your body as the body of a car. When you first purchase it, the ride is smooth, the engine runs great, and there seems to be no issues or easy to fix issues. The older the car gets, the more care it requires. By the same token, the older we get, the more TLC we need to apply. To sum it up, say for example that you check all the boxes of these factors. Perhaps your parents had diabetes, you are Hispanic, and you are in your 50s or 60s. It is true that all of these factors put you at a higher risk for type 2 diabetes, but this is where your actions come into play. Here, we are referring to the lifestyle changes you could make to prevent or change the course of the disease. The next factor that might affect your prevalence of contracting diabetes type 2 is your location. This is a factor that can be changed, but we cannot change the past, or in this case, our place of origin, or the place we grew up in, the economic changes that affected us. The force of economic change is a very powerful and pervasive factor. The majority of people in the developing world have changed their lifestyle, particularly through mechanized transportation, machine labor, loss of physical activity, higher consumption of processed foods, higher consumption of refined carbohydrates, foods that are very low in protein yet high in saturated fats and cholesterol, very little consumption of fruits and vegetables, and whole food overall. With these changes, we have started seeing a rise in the prevalence of type 2 diabetes even in the rural parts of the developing world. Now let's look on the bright side of things. We have a whole another set of factors we can modify. These are lifestyle factors, weight gain and overweight or obesity, physical inactivity, increased stress levels, and harmful or unhealthy habits. Number one of the factors we have control over is being overweight. Stress, certain medications, genetics, and high cholesterol are all known risk factors for type 2 diabetes, but being overweight or obese is an even stronger predictor. Being overweight may make your body susceptible to becoming resistant to insulin. It is unclear why exactly we get insulin resistance, but a couple of the suggestions are that being overweight causes metabolic stress, which includes inflammatory responses in cells normally sensitive to insulin, which then become insensitive. Also, obesity in fat deposits around the organs deplete oxygen levels locally and could be a contributing factor to insulin resistance. Carrying excess body fat is the number one risk factor for type 2 diabetes. Up to 90% of those who develop the disease are overweight. Being overweight is one of the most significant factors. Therefore, if you are over the age of 35 and you are overweight, it might be a good idea to do diabetic screening. So how obese are we? In the United States, 1 out of 3 adults are obese, meaning they have a BMI of more than 30. The U.S. obesity prevalence was 41.9% in 2017 through March of 2020. According to 2017-2018 data from the National Health and Nutrition Examination Survey, nearly 1 in 3 adults, that is 30.7%, are overweight, more than 2 in 5 adults, that is 42.4%, have obesity, and about 1 in 11 adults, that is 9.2%, have severe obesity. Am I safe if I'm skinny? Diabetes could be the result of a mixture of factors. You could be a normal weight and still develop diabetes. There are people that get type 2 diabetes for different reasons and due to different factors. They will also respond differently to treatment. So it is important to understand what works for your body and for your diabetes. It is also important to understand that improvement pace is different for different people. Factor number 2 of the ones we can change is physical inactivity. Not getting enough physical activity can raise a person's risk for developing type 2 diabetes. Physical activity helps control blood sugar or glucose, weight, and blood pressure and helps raise HDL, the good cholesterol, and lower the LDL, the bad cholesterol. Adequate physical activity is defined as a minimum of 150 minutes of moderate activity a week. This adequate physical activity can also help reduce the risk of heart disease and nerve damage, which are often problems for people with diabetes. What are some of the benefits of being more physically active? Improved sleep, reduced stress levels, increased energy levels and the ability to perform everyday activities, improved cognitive ability and reduced risk of dementia, improved bone and musculoskeletal health, improved blood circulation, helps with losing weight, and increases longevity. Other risk factors for type 2 diabetes are high stress levels and poor sleep patterns. Stress. This is another epidemic that we're constantly battling. Stress does not cause diabetes, but increased stress levels affect blood sugar and intervene with body's ability to properly process the glucose. Mental stress is also known to increase blood sugar levels in people with type 2 diabetes. In people with diabetes type 1, the blood sugar response may vary. We have been experiencing stress since our existence. The process has been the same since the times when our ancestors used to fight wild beasts to survive. You might recall that when you are stressed, your body goes into a fight or flight mode. That response releases stress hormones that help you prepare for the stress. They increase your blood sugar, providing your body with the fuel to fight or flee the stress or the stressor. Our ancestors had the necessity for the fuel and they burned it off by using their body physically. In the past, almost all of the stressors were danger to the body and had to be physically dealt with. In today's modern world, things are different. We still experience stress, even higher levels of stress. Our bodies still release the same fuel and raise the blood sugar levels. But in most cases, we don't physically burn the fuel, which leaves us with increased levels of blood sugar. For most people, this is not a serious problem because the body has the tendency to heal itself and bring the levels back to normal. For someone with diabetes, increased stress levels might present a bigger problem since their body can't properly self-regulate the sugar. If stress is something diabetics experience frequently, their body sugar may remain constantly high unless they make an effort to bring it back down. The next factor we're able to control is sleep. People who have poor sleep habits are at greater risk for becoming overweight or obese according to several studies. Those who get less than 7 hours of sleep per night have higher risk for developing diabetes type 2. Chronic sleep deprivation may lead to insulin resistance, which can result in high blood sugar and diabetes. Some studies show that prolonged sleep deprivation can affect hormones that control appetite. This could lead to weight gain, which can lead to diabetes, which leads to more sleep problems. People with type 2 diabetes experience even more sleep issues, including obstructive sleep apnea, pain or discomfort, restless leg syndrome, and increased night urination. Now let's look at the symptoms. What are some of the symptoms of diabetes? These symptoms are associated with having high blood sugar. They are typically not present when your sugar levels are under control. Some of the most common ones are feeling tired or sleepy, having the need to urinate, always feeling thirsty, numb or tingling hands and feet, constant hunger, having cuts or wounds that won't heal. Sometimes there is sudden weight loss with no reason, and blurry vision. It is not necessary for any of these symptoms to occur for you to have diabetes. It isn't uncommon for people to experience no symptoms at all and still have high blood glucose levels. Just because you don't have these symptoms, it doesn't mean everything is okay and you should still check your blood sugar levels. Why do we need to be concerned with our blood sugar levels? There are multiple things that blood sugar can do to our body if the levels are too high. That high level of sugar in our blood slowly poisons parts of the body, the eyes, the heart, the nerves, the kidneys, and also the blood flow to your feet and your fingers. It can affect many of our organs. For example, it can lead to blurry vision or even blindness. It can also affect our kidney function and damage our kidneys. It can cause irreparable damage, which in some cases may lead to having the need of dialysis. It can cause nerve damage and the risk of amputations. Having diabetes also causes us to have more cavities and more severe damage to our teeth. It is very important to keep diabetes under control by keeping our diet healthy, following up with doctor's orders, and checking our blood sugar to prevent these from happening. Another very serious condition of diabetes is diabetic neuropathy. Up to 50% of diabetics eventually develop neuropathy or damage to their nerves. Neuropathy can be very painful, and that pain is generally resistant to conventional treatment. So what is better, higher or lower blood sugar levels? So whereas high blood glucose affects several of our organs, damages our cells, and may result in blindness, infections, kidney failure, and other chronic conditions, including premature death, very low blood glucose means we may lose consciousness and die. The key is to keep the sugar levels balanced. There are many suggestions aside from medication that can help keep your blood sugar under control. In the next few segments, we will discover some of the most effective methods, lifestyle and dietary changes that will help keep you on track. Until then, mahalo and aloha.